Vincristine is a type of chemotherapy medicine that's injected directly into the patient's vein and used to treat many types of cancer, including but not limited to Wilms tumor, childhood leukemia, neuroblastoma, and Hodgkin's disease. Often this is used with other chemotherapy medications depending on the disease being treated and the patient's individual needs.
This medicine disrupts the process of mitosis, making the cells unable to divide properly and effectively slowing the spread of cancer cells. However, since it goes through the entire bloodstream, chemotherapy medicine unfortunately affects healthy cells as well. This causes many side effects, including but not limited to hair loss, constipation, difficulty walking, headaches, lung damage, and low white blood cells, which results in a heavily compromised immune system. Vincristine is used in many childhood illnesses, so it's important to look at its effects on not only the patient, but on the patient's family that act as the primary caregivers throughout the multiple month-long process. When we do that, we see that the side effects of this medication can be detrimental to a patient and their family's mental health. A 1993 study from Michigan State University that explored these mental health effects explains as follows, quote, "Although there have been significant advances in the treatment and survival rates of patients with cancer, cancer remains particularly dreaded by patients and their families. The emotional impact of the disease has placed added responsibilities on families for the physical and emotional care of patients." End quote. The study then goes on to discuss that a caregiver's level of optimism regarding the situation seems to directly impact their ability to cope with and adapt to the stress that's associated with caring for a cancer patient.
Now, regardless of how high survival rates may be, or how many people undergo the process and end up living great lives, watching one's child suffer so heavily from vincristine side effects can be extremely draining on a person's optimism in given moments. It's understandably difficult to maintain optimism when you watch a person lose the ability to carry out simple life functions as a result of the medicine for the disease they have.
Another study, conducted by the American Cancer Society in 2008, found solid evidence regarding the psychological effect that cancer has on family caregivers and concluded that, quote, "Accumulating evidence has supported the concept that cancer affects not only the patients/survivors, but also their family members." End quote. The last study I'd like to bring up is from Indiana University in 2013 about the impacts on family caregivers that have patients with lung cancer. They found that, quote, "caregivers' physical health and mental health were below population norms. More than 50% of caregivers reported negative emotional effects of caregiving, and more than 33% reported negative physical health effects of caregiving." End quote. Across all studies, we see that cancer and the chemotherapy process very frequently has a negative mental effect on patients and their families. This effect can only be amplified in cases where vincristine is used because of the bond between a parent and their child. So the next logical question to ask is, what can we do to fix it? And each of these studies gave fairly similar answers to this question, but the American Cancer Society put it best when they concluded, quote, "The current findings have implications for helping clinicians identify caregivers who are at a mental health risk. Despite the potential benefit, few psychosocial and behavioral interventions to enhance cancer caregivers' quality of life have been developed. Interventions that emphasize education and information about medical treatment and disease processes, focus on improving problem-solving skills, and provide information along with psychological counseling appear to be successful in decreasing caregiving stress and improving the quality of life of caregivers, as well as promoting survivors to return to their usual healthy self."
These studies have overwhelmingly advocated for some sort of mental health screening or intervention for patients and their families since 1993. But for some reason, these programs have unfortunately still not been widely implemented as a part of the chemotherapy process.
I hope I was able to teach you something about vincristine and chemotherapy treatment in general. If you'd like to take a look at the sources I used to research this presentation, I've left them in the video description. Thank you for listening.